Hello everyone, I'm Dr. Piyusha Majumdar and today I'm going to take a session on stigma and discrimination related to COVID 19. So, when we begin with the introduction to COVID 19, it's a large family of virus that cause a wide range of illness from a common cold to more severe disease. If we talk about the strains of COVID 19, it has its ancestors, which is related with MERS and SARS, which is MERS is Middle East Respiratory Syndrome and SARS is Severe Acute Respiratory Syndrome. So, on 31st December 2019, WHO Country Office informed of pneumonia cases of unknown causes in Wuhan city, which is in Hubei province of China. And they have declared COVID 19 as an outbreak. So, when we talk about the stigma and discrimination, the international, the context or the first discrimination attached with COVID 19 when Trump called this virus as a Chinese virus or Wuhan virus. So these are the racial discrimination and severe criticism which is faced by China. I know the disease is mysterious, but still, if we talk about the real danger of COVID 19, it is the discrimination. Why discrimination? Because it triggers racism and xenophobia because it is putting everyone at risk. Many people could fake not to have the virus just because of being scared of labeled as the one with the coronavirus. There are certain rumor and fake news also which has become viral. So social media has not only propagated the doubtful rumors on the emergence of the virus, but also it has brought forth the absurd method for prevention. And corona is, it is linked to discrimination and prejudice. There are many patients with genetic and chronic diseases being labeled, stereotyped and separated, and it has become a daily routine nowadays. When we talk about kind of stigma which is existing, so there are three kinds of people or three sets of people which is being stigmatized now. Those who are in quarantine, whether they are tested positive or not, but they are being stigmatized. There are many state government who are violating the medical ethics code by publicizing the address, detail, marking the door of their home with sticker, even large poster and stamping them with inedible ink. There are many stories are coming out of the people who are being thrown out of their home or shunned just because people predicted that they are suffering from coronavirus. The another category of people who are being stigmatized now, they are the health workers, doctors or the frontline workers. It is for the first time the health workers are experiencing the stigma. So, talking about the stigma, it is mainly the result of people's poor knowledge about COVID 19, how it spread. And everything is compounded by the large amount of fake news and false information being generated today. There's some group who face the additional element that discrimination against them is already there, and COVID 19 has become one of the other reason to stigmatize them. So when we're talking about stigma, it is the closest people are facing if we compare it with HIV/AIDS. In HIV/AIDS, stigma did not extended in general to the health workers, but if we talk about COVID 19, it has extended to many other communities. And this kind of a stigma is harming people in three major ways. The first way is the public stigma, in which people endorse stereotype about the individual with COVID-19. leading to discrimination. They are not renting to people who may have been exposed, excluding them from school, not inviting them into their faith-based community, uh, you know, community or any congregation. Second is the self-stigma or the disrespect that result when people associated with the virus internalize stereotype or feel tainted or dirty. It is very difficult enough to dealing with the virus. And the third one, which has been called a label avoidance. People are not coming ahead to take the treatment because of the stigma associated with it. The vulnerable group. If we talk about the vulnerable group, so we have already discussed the three sets of people. Apart from this, we have people of Asian descent who are experiencing stigma these days, people who have traveled to foreign countries in the past, emergency responders, or the healthcare professional. Now, why is COVID-19 causing so much of stigma? There are three main factors. First one, it is the disease which is new to everyone, for which there is still the reason which is unknown to the people. And it is the tendency of human that they are often afraid of the unknown. And it's very easy to associate that fear with other. As a result, stigma is, it is there among the people. Now, what is the impact of the stigma? The stigma can drive the people to hide the illness, to avoid discrimination. It can prevent people from seeking healthcare immediately, and it also discourages them from adopting healthy behavior. Now it is high time for us to discuss about the stigma and took a real preventive measure so that we can handle or combat this pandemic. Thank you so much.